What is aripiprazole? Aripiprazole is a medication that belongs to a class of drugs known as atypical antipsychotics. It is also sold under the brand name Abilify. Aripiprazole is primarily used to treat various mental health conditions, including schizophrenia. Aripiprazole can help manage the symptoms of schizophrenia, a mental disorder characterized by distorted thinking, hallucinations, delusions, and impaired cognitive function. Bipolar disorder, it is used to treat manic and mixed episodes associated with bipolar disorder, which involves episodes of extreme mood swings, from manic, high energy, to depressive, low energy, states. Major depressive disorder. In some cases, it is prescribed as an adjunctive treatment for major depressive disorder when standard antidepressants alone have not been effective. Autism-related irritability. Aripiprazole is also approved for the treatment of irritability associated with autism spectrum disorders in children and adolescents. Aripiprazole works by modulating the activity of certain neurotransmitters in the brain, such as dopamine and serotonin, which play a role in mood, behavior, and psychosis. It is considered an atypical antipsychotic because it has a unique mechanism of action compared to older antipsychotic medications. It is important to note that aripiprazole should be taken under the supervision and guidance of a qualified healthcare professional, as it may have various side effects and potential interactions with other medications. Patients should always follow their healthcare provider's instructions and inform them of any existing medical conditions or other medications they are taking when considering aripiprazole. Are there other indications for the use of aripiprazole? Aripiprazole is used for various indications beyond those I mentioned earlier. In addition to treating schizophrenia, bipolar disorder, and major depressive disorder. As an adjunctive treatment, aripiprazole has been approved for the following indications: treatment of irritability in autism spectrum disorders. Aripiprazole is approved for the treatment of irritability associated with autism spectrum disorders in pediatric patients aged 6 to 17 years. It can help reduce symptoms of aggression, temper tantrums, and self-injurious behavior in children and adolescents with autism. Adjunctive therapy for major depressive disorder, MDD. In cases where standard antidepressant therapy has not provided sufficient relief from depressive symptoms, aripiprazole may be prescribed as an adjunctive treatment alongside an antidepressant. Treatment of Tourette's disorder. Aripiprazole has shown efficacy in the management of tics and associated behavioral issues in individuals with Tourette's disorder. Maintenance treatment of bipolar I disorder. Aripiprazole can be used for the maintenance treatment of bipolar I disorder to help prevent recurrent manic or mixed episodes. It is often prescribed in combination with other medications. Off-label uses. In some cases, aripiprazole may be prescribed off-label for conditions like obsessive-compulsive disorder, OCD, post-traumatic stress disorder, PTSD, and generalized anxiety disorder, GAD, although these uses are not FDA approved. The use of aripiprazole in these various indications may depend on clinical judgment, patient history, and the specific circumstances of the individual being treated. It is important to follow the guidance and recommendations of a qualified healthcare provider when considering aripiprazole for any medical condition. The safety and effectiveness of the medication in off-label uses should be carefully assessed by a healthcare professional. What is the pharmacokinetics of aripiprazole? The pharmacokinetics of aripiprazole involves the processes of absorption, distribution, metabolism, and elimination of the drug within the body. Here is an overview of the key pharmacokinetic characteristics of aripiprazole. Aripiprazole is well absorbed when taken orally, with a peak plasma concentration typically reached within 3 to 5 hours after administration. Food does not significantly affect its absorption, so it can be taken with or without meals. Distribution. Aripiprazole has a relatively high volume of distribution, meaning it is widely distributed throughout the body's tissues. It binds extensively to plasma proteins, primarily to albumin. Metabolism. Aripiprazole is primarily metabolized in the liver by the cytochrome P450, CYP, enzyme system, particularly CYP2D6 and CYP3A4. The main metabolite of aripiprazole is called dehydroaripiprazole. Both aripiprazole and its metabolite are active compounds. The pharmacological activity of dehydroaripiprazole is thought to be lower than that of aripiprazole. Elimination. The elimination half-life of aripiprazole is about 75 hours, which is relatively long compared to some other antipsychotic medications. Aripiprazole and its metabolite are primarily excreted in the urine, about 27% of the dose, and feces, about 60% of the dose. Steady state. It takes about 14 days of continuous dosing to achieve a steady state concentration of aripiprazole in the body. Aripiprazole is often administered once daily due to its long half-life, making it suitable for convenient daily dosing. Special populations. The pharmacokinetics of aripiprazole can vary in certain populations, such as in elderly individuals and those with impaired liver or kidney function. Dose adjustments may be required in such cases. Aripiprazole is available in various formulations, including oral tablets, orally disintegrating tablets, and injectable formulations. The choice of formulation and dosing regimen will depend on the specific condition being treated and individual patient factors. It's important for healthcare providers to consider these pharmacokinetic characteristics when prescribing aripiprazole to ensure its safe and effective use. What is the pharmacodynamics of aripiprazole? The pharmacodynamics of aripiprazole refers to how the drug exerts its effects on the body, particularly its interactions with receptors in the central nervous system and its impact on neurotransmitter activity. Aripiprazole is classified as an atypical antipsychotic, and its pharmacodynamics are characterized by its unique mechanism of action. Here are the key aspects of the pharmacodynamics of aripiprazole. Partial agonist at dopamine D2 receptors. Aripiprazole is a partial agonist at dopamine D2 receptors. This means that it has the ability to both stimulate and block these receptors to varying degrees, depending on the level of dopamine activity in the brain. In areas of the brain where dopamine activity is excessively high, aripiprazole acts as a dopamine receptor antagonist, helping to reduce overstimulation. In regions with low dopamine activity, it acts as a partial agonist, providing some stimulation to counteract low mood or negative symptoms of psychosis. Serotonin 5-HT1A receptor agonism. Aripiprazole is also a partial agonist at serotonin 5-HT1A receptors. This property is believed to contribute to its antidepressant effects, as the activation of these receptors can have a positive impact on mood. Antagonism at serotonin 5-HT2A receptors. Aripiprazole acts as an antagonist at serotonin 5-HT2A receptors, which can help reduce the occurrence of hallucinations and other psychotic symptoms by blocking the effects of excess serotonin activity. Effect on other receptors. Aripiprazole also interacts with other receptors, such as alpha-adrenergic and histamine H1 receptors, although its effects on these receptors are generally less pronounced and less central to its primary mechanisms of action. Balancing dopamine and serotonin activity. Aripiprazole is known for its ability to help restore the balance of dopamine and serotonin activity in the brain, which is thought to be important in the management of various mental health conditions, including schizophrenia, bipolar disorder, and depression. Partial agonist. The unique feature of aripiprazole as a partial agonist allows it to provide stabilizing effects on neurotransmitter systems without completely shutting them down. This is in contrast to some older antipsychotic medications that act as full dopamine receptor antagonists and can result in more profound side effects. It's important to note that the specific pharmacodynamic effects of aripiprazole may vary, depending on individual factors, including the patient's condition, the dosage, and the presence of other medications. The overall goal is to help manage the symptoms of mental health conditions while minimizing side effects. Patients should discuss any questions or concerns about aripiprazole's pharmacodynamics with their healthcare provider. In what strengths aripiprazole is available? Aripiprazole, sold under the brand name Abilify and its generic equivalents, is available in various strengths and formulations, including Oral tablets. Aripiprazole oral tablets come in various strengths, including 2 mg, 5 mg, 10 mg, 15 mg, 20 mg, and 30 mg. These tablets are typically taken once daily and are available in different colors and shapes to distinguish the strengths. Orally disintegrating tablets, ODT. These are tablets that can be placed on the tongue, where they rapidly disintegrate and can be swallowed without the need for water. Aripiprazole ODT is available in strengths of 10 mg, 15 mg, and 20 mg. Oral solution. Aripiprazole oral solution is available in a concentration of 1 mg per milliliter. This formulation is often used for individuals who have difficulty swallowing tablets or prefer a liquid medication. Injectable formulation. Aripiprazole is also available in a long-acting injectable form, typically used for the maintenance treatment of schizophrenia or bipolar I disorder. These injections are administered by a healthcare professional and are given at varying intervals, such as once a month or once every 3 months, depending on the specific product. The choice of strength and formulation will depend on the individual's specific medical condition, the prescriber's recommendations, and the patient's preferences and needs. It is important to follow the dosing instructions provided by a healthcare professional and the information on the medication label. Dosing may be adjusted based on the patient's response to the medication and any side effects. What is the recommended dosage for aripiprazole? The recommended dosage for aripiprazole, Abilify, can vary depending on a specific condition being treated, the age of the patient, and individual factors. A healthcare provider will determine the appropriate dosage and may adjust it based on the patient's response to the medication and any side effects. Here are some general guidelines for the recommended dosages of aripiprazole for various conditions. Schizophrenia. Initial dosing. The recommended starting dose for adults is typically 10 mg to 15 mg once daily. Maintenance dosing. The maintenance dose can vary, but it often falls in the range of 15 mg to 30 mg per day. Adolescents, aged 13 to 17. The starting dose is often 2 mg per day, with the potential to increase to 5 mg per day after a few days, and further adjustments if needed. Bipolar disorder. Acute manic or mixed episodes. For adults, the recommended starting dose is usually 15 mg once daily. The dose can be increased to 30 mg per day as needed. Maintenance treatment. Adults may continue with the maintenance dose ranging from 15 mg to 30 mg per day. Major depressive disorder, adjunctive treatment. The typical recommended dose when used as an adjunct to an antidepressant is 2 mg to 5 mg once daily. Irritability associated with autism spectrum disorders. For pediatric patients, aged 6 to 17, the recommended starting dose is often 2 mg per day, which can be increased to 5 mg per day after a few days if needed. Tourette's disorder. The recommended starting dose for Tourette's disorder in children and adolescents is often 2 mg to 5 mg once daily. It's important to note that aripiprazole dosages may vary based on individual factors, including the patient's age, weight, response to treatment, and the presence of other medical conditions. Dosage adjustments should only be made under the guidance and supervision of a qualified healthcare provider. Additionally, aripiprazole may be available in different formulations, such as tablets, orally disintegrating tablets, and oral solution, with each having specific strengths. Patients should adhere to their healthcare provider's instructions and the dosing information provided with the prescribed formulation. If you have any questions or concerns about your aripiprazole dosage, be sure to discuss them with your healthcare provider. What are the reported side effects of aripiprazole? Aripiprazole, like all medications, can have potential side effects. Not everyone will experience these side effects, and the severity and occurrence of side effects can vary from person to person. Common side effects of aripiprazole may include nausea. Aripiprazole can sometimes cause nausea, which can be minimized by taking it with food. Vomiting. Some individuals may experience vomiting as a side effect. Insomnia. Aripiprazole may affect sleep patterns and cause difficulty falling asleep or staying asleep. Headache. Headaches are a possible side effect of aripiprazole. Restlessness or akathisia. Some people may experience a sense of restlessness or inner agitation known as akathisia. Dizziness. Aripiprazole can lead to dizziness or lightheadedness in some individuals. Weight gain. Weight gain is a potential side effect, which may be more likely with long-term use. Drowsiness or fatigue. Aripiprazole can cause drowsiness or fatigue in some individuals. Tremors or shaking. Hand tremors or shaking may occur as a side effect. Dry mouth. A dry mouth is a possible side effect of aripiprazole. Constipation. Some people may experience constipation. Increased blood sugar. Aripiprazole may lead to elevated blood sugar levels, which can be a concern, especially for individuals with diabetes. Increased prolactin levels. Aripiprazole may cause an increase in prolactin hormone levels, potentially leading to symptoms like breast enlargement or lactation, even in males. Extrapyramidal symptoms. These can include movement disorders such as Parkinsonism, dystonia, and dyskinesia. Orthostatic hypotension. A sudden drop in blood pressure when standing up may occur in some individuals. Neuroleptic malignant syndrome, NMS. Though rare, aripiprazole, like other antipsychotic medications, may be associated with NMS. A potentially life-threatening condition characterized by high fever, muscle rigidity, and altered mental status. Suicidal thoughts. Aripiprazole and other antipsychotic medications have been associated with an increased risk of suicidal thoughts, particularly in young adults. It's important to note that not all individuals will experience these side effects, and some side effects may be more common in certain populations. Additionally, aripiprazole is associated with a lower risk of certain side effects, such as metabolic issues like weight gain and changes in cholesterol and triglyceride levels, compared to some other antipsychotic medications. If you are prescribed aripiprazole and experience any side effects, it's essential to communicate with your healthcare provider. They can help monitor side effects and adjust your treatment plan if necessary. In some cases, the benefits of the medication may outweigh the potential side effects, especially in the treatment of serious mental health conditions like schizophrenia and bipolar disorder. What are the contraindications for the use of aripiprazole? Aripiprazole, Abilify, has specific contraindications, which are situations or conditions in which the medication should not be used due to the potential for harm or adverse effects. Contraindications for aripiprazole include allergic reaction. A known hypersensitivity or allergic reaction to aripiprazole or any of its components is a contraindication. Pediatric patients under 6 years of age. Aripiprazole is not approved for use in children under 6 years of age for any indication. Certain medical conditions. Aripiprazole should be used with caution or not used at all in individuals with certain medical conditions, such as cardiovascular diseases. Aripiprazole can lead to orthostatic hypotension, a sudden drop in blood pressure when standing, and should be used cautiously in individuals with heart conditions. Stroke. A history of stroke is a contraindication. Seizure disorders. Aripiprazole may lower the seizure threshold, so it should be used with caution in individuals with a history of seizures or epilepsy. Dementia-related psychosis. Aripiprazole is not approved for the treatment of dementia-related psychosis, and may be associated with an increased risk of stroke and death in elderly patients with dementia-related conditions. Hypersensitivity to other antipsychotic medications. Individuals with a history of hypersensitivity to other antipsychotic drugs, such as phenothiazines or butyrophenones, may have a cross-sensitivity to aripiprazole. Concomitant use with CYP2D6 inhibitors. Concomitant use of strong CYP2D6 inhibitors. Example, fluoxetine, paroxetine, with aripiprazole should generally be avoided, as these medications can increase aripiprazole's blood levels. Lactation. Aripiprazole is excreted in breast milk, and the use of aripiprazole during breastfeeding should be carefully considered, taking into account the potential risks to the infant. It's crucial for healthcare providers to carefully assess a patient's medical history and current health status before prescribing aripiprazole to ensure that it is safe and appropriate for the individual. If you have any concerns about the use of aripiprazole or its contraindications, it's important to discuss these with your healthcare provider, who can provide guidance and alternative treatment options if needed. What are the precautions that need to be taken while prescribing aripiprazole? When prescribing aripiprazole, Abilify, healthcare providers should take several precautions and considerations to ensure its safe and effective use. Here are some of the precautions and guidelines that should be taken into account. Individual assessment. Conduct a thorough assessment of the patient's medical history, including any existing medical conditions, medications, prescription, over-the-counter, or herbal supplements, allergies, and a history of psychiatric illnesses. This information will help in determining whether aripiprazole is a suitable treatment option. Pediatric and adolescent patients. Aripiprazole is used in children and adolescents for specific indications, but it should be prescribed with caution in this population. Regular monitoring and close supervision are essential when used in pediatric patients. Elderly patients. Special care is required when prescribing aripiprazole to elderly patients, particularly those with dementia-related conditions. Aripiprazole is not approved for the treatment of dementia-related psychosis and has been associated with an increased risk of stroke and death in this population. Metabolic changes. Aripiprazole may lead to metabolic changes, including weight gain, increased blood sugar levels, and changes in lipid profiles. Regular monitoring of these parameters and lifestyle interventions may be necessary. Pregnancy and lactation. The use of aripiprazole during pregnancy and breastfeeding should be carefully considered. The potential risks and benefits must be weighed for each individual. Alcohol and CNS depressants. Aripiprazole can enhance the effects of alcohol and other central nervous system (CNS) depressants. Patients should be advised to avoid alcohol and other substances that may cause sedation. Adherence to dosage. Patients should be educated on the importance of adhering to the prescribed dosage and not making changes without consulting their healthcare provider. Regular follow-up. Patients taking aripiprazole should have regular follow-up appointments with their healthcare provider to assess the medication's efficacy and monitor for side effects and any emerging concerns. These precautions are essential to ensure that aripiprazole is used safely and effectively. Aripiprazole should only be prescribed and managed by qualified healthcare professionals who can tailor the treatment to the specific needs of the patient. It's important for patients to communicate openly with their healthcare provider about any concerns or side effects they may experience during treatment with aripiprazole. What drug interactions reported while using aripiprazole? Aripiprazole, Abilify, can interact with various drugs, potentially affecting its effectiveness or leading to an increased risk of side effects. It's crucial for healthcare providers to be aware of potential drug interactions when prescribing aripiprazole. Some notable drug interactions with aripiprazole include strong CYP2D6 inhibitors. Concomitant use of strong CYP2D6 inhibitors, such as fluoxetine and paroxetine, can increase the blood levels of aripiprazole. Dosage adjustments or alternative treatment options may be considered. CYP3A4 inhibitors. Drugs that inhibit the CYP3A4 enzyme, like ketoconazole and clarithromycin, can also increase aripiprazole levels. Dose adjustments may be necessary when using these medications alongside aripiprazole. CYP2D6 inducers. CYP2D6 enzyme inducers, such as rifampin and carbamazepine, may decrease aripiprazole levels. The dosage of aripiprazole may need to be adjusted in the presence of these drugs. Dopaminergic medications. Combining aripiprazole with other dopaminergic medications, such as levodopa, may diminish the antipsychotic effects of aripiprazole and should be used with caution. Antihypertensive medications. Aripiprazole can cause orthostatic hypotension, a drop in blood pressure when standing, and concomitant use with antihypertensive medications may increase this effect. Other antipsychotic medications. Combining aripiprazole with other antipsychotic drugs can lead to an increased risk of extrapyramidal symptoms, movement disorders, and should generally be avoided. Serotonergic medications. Aripiprazole has some serotonergic effects, and the concurrent use of other serotonergic drugs may increase the risk of serotonin syndrome. Patients should be closely monitored for symptoms such as agitation, hallucinations, rapid heartbeat, fever, muscle stiffness, and tremor. Lithium. Combining aripiprazole with lithium may increase the risk of neurotoxicity. Patients taking this combination should be monitored for signs of lithium toxicity. Phenothiazines. Concomitant use of aripiprazole with phenothiazines, another class of antipsychotic medications, may increase the risk of extrapyramidal symptoms. CYP2D6 genotype. Individuals with known CYP2D6 poor metabolizer status may have elevated aripiprazole blood levels, which could increase the risk of side effects. Dose adjustments may be necessary in these cases. These are some of the drug interactions to be aware of when using aripiprazole. It is essential for healthcare providers to carefully review a patient's medication history and consider the potential interactions when prescribing aripiprazole. Patients should also inform their healthcare provider about all the medications, supplements, and substances they are using to ensure safe and effective treatment. Adjustments to the medication regimen may be necessary based on individual factors and the specific drugs involved in potential interactions. What are the similar drugs available and how aripiprazole scores in comparison? Aripiprazole, brand name Abilify, is an atypical antipsychotic medication used to treat various mental health conditions. There are several other atypical antipsychotic drugs available, each with its own unique characteristics. Here is a list of some similar drugs, and a brief comparison of aripiprazole to them. Risperidone, Risperdal. Risperidone is used to treat schizophrenia, bipolar disorder, and irritability associated with autism. It is available in various formulations, including oral tablets, orally disintegrating tablets, and long-acting injections. Compared to aripiprazole, it has a different side effect profile, including a higher risk of weight gain and sedation. Olanzapine, Zyprexa. Olanzapine is indicated for the treatment of schizophrenia and bipolar disorder. It is known for its efficacy in managing acute episodes of mania. However, it is associated with a higher risk of weight gain and metabolic side effects compared to aripiprazole. Quetiapine, Seroquel. Quetiapine is used to treat schizophrenia, bipolar disorder, and major depressive disorder, as an adjunct. It is also known for its sedative effects, which can be beneficial for individuals with insomnia. Like other antipsychotic medications, it may lead to weight gain and metabolic changes. Ziprasidone, Geodon. Ziprasidone is approved for the treatment of schizophrenia and bipolar disorder. It is often considered to have a lower risk of weight gain compared to some other atypical antipsychotics, but may be associated with a higher risk of QT interval prolongation, a cardiac side effect. Lurasidone, Latuda. Lurasidone is used for the treatment of schizophrenia and bipolar depression. It has a more favorable weight profile compared to some other antipsychotic drugs. However, it should be taken with food to maximize absorption. Brexpiprazole, Rexulti. Brexpiprazole is another atypical antipsychotic used to treat schizophrenia and major depressive disorder, as an adjunct. It is closely related to aripiprazole and shares some of its pharmacological properties. It has a lower risk of weight gain and metabolic side effects compared to some other antipsychotic medications. Cariprazine, Vraylar. Cariprazine is indicated for schizophrenia and bipolar disorder. It has a unique mechanism of action similar to aripiprazole and is known for its lower risk of weight gain compared to some other antipsychotic medications. The choice of which atypical antipsychotic to use depends on the specific condition being treated, individual patient characteristics, and potential side effects. Aripiprazole is often considered favorable because it has a relatively low risk of weight gain and metabolic side effects compared to some other antipsychotic drugs. However, its use may be associated with other side effects, such as restlessness, akathisia, and extrapyramidal symptoms. Ultimately, the decision to use a specific antipsychotic medication should be made by a healthcare provider, taking into account the patient's needs and medical history. The relative benefits and risks of each medication should be discussed with a qualified healthcare professional. What are the other popular aripiprazole brands available? Aripiprazole is the generic name for the medication, and Abilify is the brand name under which it is most commonly known. Brands. While Abilify is the most widely recognized brand, especially in the United States, there may be other brand names under which aripiprazole is marketed in various countries and regions. These brand names may vary based on the pharmaceutical company that produces and markets the medication. Some of the other popular brand names for aripiprazole include Aripmount, Sun Pharma. Aripmount is a brand of aripiprazole produced by Sun Pharma. Aripiprex, Orion. Aripiprex is a brand of aripiprazole produced by Orion Pharma. Aripazole, Sun Pharma. Aripazole is another brand of aripiprazole by Sun Pharma. Abilify Maintaina. In addition to the oral forms of aripiprazole, Abilify Maintaina is a brand used for the long-acting injectable form of the medication, which is administered less frequently than daily oral dosing. Aristada. Aristada is another brand name for long-acting injectable aripiprazole, available in various dosages and intervals for maintenance treatment. These are some of the brand names of aripiprazole that may be available in different regions. The choice of brand may depend on the pharmaceutical company producing the medication, regional availability, and healthcare provider recommendations. Regardless of the brand name, the active ingredient in all these medications is aripiprazole, and they are used to treat a variety of mental health conditions, including schizophrenia, bipolar disorder, and major depressive disorder. Patients should use the brand name prescribed by their healthcare provider and follow the dosing instructions provided with that specific product. Is aripiprazole available in combination with any other drug? One notable combination is aripiprazole combined with another antipsychotic medication called sertraline. This combination product is known as Symbyax. Symbyax is a medication that contains both olanzapine, an atypical antipsychotic, and fluoxetine, a selective serotonin reuptake inhibitor or SSRI. It is primarily used for the treatment of bipolar depression and treatment-resistant depression. The combination of aripiprazole with other drugs may be explored in the future for specific therapeutic purposes. As researchers and pharmaceutical companies continue to develop and test new treatment options,